This lecture will wrap up ARDS by going over the interventions used for ARDS. It's on page 627. So general management of the patient with ARDS focuses on the three phases of ARDS. The exudative phase includes early changes of dyspnea and tachypnea resulting from the alveoli becoming fluid-filled and from pulmonary shunting and atelectasis. Early interventions focus on supporting the patient and providing oxygen. The second phase, the fibroproliferative phase, is when increased lung injury leads to pulmonary hypertension and fibrosis. Multiple organ dysfunction syndrome can occur. Interventions focus on delivering adequate oxygen, preventing complications, and supporting the lungs. The resolution phase usually comes after 14 days. Resolution of the injury can occur. If not, the patient either dies or has chronic disease. Fibrosis may or may not occur. The patient with ARDS often needs intubation and mechanical ventilation. Low tidal volumes have been shown to prevent lung injury. PEEP is started at 5 centimeters of water, H2O, and increased to keep the oxygen saturation adequate. PEEP levels may need to be high. Pressure-controlled ventilation is preferred over volume-controlled ventilation to promote the non-functional alveoli to participate in gas exchange. Because one side effect of PEEP is tension pneumothorax, assess lung sounds hourly and suction as needed to maintain a patent airway. Positioning may be important in promoting gas exchange, but the exact position is controversial. Some patients do better in a prone position. Manually turning the patient every 2 hours has been shown to improve perfusion. Early progressive mobility also has demonstrated benefit in reducing ventilator needs, days on the ventilator, and mortality. For severe ARDS, extracorporeal membrane oxygenation using heart-lung bypass equipment has been a successful life support technique when the patient does not improve with more traditional management. So with that, the extracorporeal membrane oxygenation, just like it sounds. So extracorporeal, if you had to guess what that means, think about what it might mean. It means like outside of the body. So that would be an instance when the blood is bypassed out of the body to a machine that functions as the lungs, right? Takes out waste and adds in oxygen and then returns the blood back to the body. Under drug and fluid therapy, antibiotics are used to treat infections when they're identified. Currently, no treatments reverse the pathologic changes in the lungs, although many interventions that modify the inflammatory response and reduce oxidative stress are under investigation. Patients with ARDS who receive conservative fluid therapy have improved lung function and a shorter duration of mechanical ventilation. Conservative fluid therapy involves infusing smaller amounts of IV fluid and using diuretics. The patient with ARDS is at risk for malnutrition, which further reduces respiratory muscle function and immune function. The interprofessional team should include a registered dietitian, and enteral nutrition or parenteral nutrition is started as soon as possible.